Our center has treated over 1,000 patients, and I personally have treated a few hundred.
Imagine I've treated over 1,000 patients.
We treat about 200 to 400 patients a year, about 5 to 10 patients every day.
We treat brain tumors, both benign and malignant. We treat tumors in the head and neck, recurrent and primary, lung cancers, pancreatic cancers, liver tumors, prostate cancers, and a variety of recurrent tumors, frankly, anywhere in the body.
It's really ideal to kind of smart bomb radiation, if you will, get the radiation exactly where we want it to hit a tumor that's moving while it's doing that, and sparing the normal tissues is sort of the holy grail of radiation oncology, if you will.
So we've found, after having our gamma knife for several months, that we're probably treating 5 times the number of treatments on our CyberKnife as we are on the gamma knife. So I think it's just a more versatile platform.
And I tell my patients that gantry is almost analogous to a record play. It can only move in that 1 degree of motion, which is a circle. Since the CyberKnife is on an arm and has a shoulder, an elbow, and wrist and fingers, it can come in at hundreds of different angles, much more so than the other treatments can.
No other radiation platform has perfected the ability to identify the target and correct for even the smallest changes in the location of that target.
Because it can track that motion, rather than bringing the fields out and around a moving target, we can actually treat that moving target with about 1 millimeter accuracy. It brings in the radiation field, it decreases the risk of radiation injury to other parts of the body, like other parts of the lung.
There are non-invasive and there are more invasive ways, and we strive with radiosurgery to move towards a non-invasive approach to tracking and treatment. And so the combination of those things is something that's attractive about this system for us.
Well, the CyberKnife allows us to treat patients that we formerly weren't really treating with radiation. It might be a patient that ordinarily would go to surgery for a lung lesion, but can't go to surgery because of a very severe COPD.
Another advantage of the CyberKnife is the treatment is done so quickly and easily. Patients don't have to come in for radiation stretched out over 4 or 5 weeks or even longer. Instead, it can be done in 1 fraction, 3 fractions, or perhaps 5 fractions. So it's much easier on the patient.
Yeah, it's really exciting and fun to do this kind of work now because the whole world is opening up. We're thinking about treating cancer in totally different new ways, and it's no longer one size fits all. Everything is individualized and tailored to the individual.
The indications keep growing. We knew we had a unique machine and product that we could use to treat things that we've been treating in the past with conventional accelerators, but now we could treat them with new effort. And those new efforts have allowed us to increase the dose, spare normal tissue, see cure rates that we've never seen before. And it's just been remarkable how it's changed how we look at cancer and treatment.
So in my opinion, it's more precise and it's a much safer treatment. It's bloodless, there's no cutting, there's no incisions. It is, in my opinion, the greatest breakthrough that's happened in radiation oncology since I started.
CyberKnife itself, and frankly radiosurgery as a broad category of a treatment paradigm, has really brought to our practice, and I would make the argument more importantly to our patients, life-changing medicine.